What are risk factors for developing tendinopathies? Shoulder conditions like rotator cuff tendinopathy are more common as we get older. It is painful, it interferes with daily activities, and it can take a long time to get rid of it. The observation that it is more common as we age is a correct observation. This research, where 16 studies were included, found that age above 50 years was the most common risk factor for developing a rotator cuff problem. Diabetes was the second most common risk factor for developing shoulder tendinopathy. It's interesting that as we get older, most people also tend to get less insulin sensitive. When we get less insulin sensitive, the blood glucose increases, and high blood glucose results in a reaction between glucose and protein, forming glycosylated proteins, which causes damage to tissue. This again triggers inflammation. You don't, however, have to be so insulin resistant that you are diagnosed with diabetes for this to take place. What else can increase the risk for tendinopathy? The following study investigated if increased blood lipid levels could be involved in tendon ruptures. 47 patients with Achilles tendon ruptures were compared to a control group. The researchers found that total cholesterol and low-density lipoprotein cholesterol (LDL) concentrations of the patients were higher, and their high-density lipoprotein cholesterol (HDL) was lower than the control group. The concentrations of triglycerides and very low-density lipoprotein cholesterol (VLDL) were also significantly higher than the control group. It's interesting that these test results also increase the risk for cardiovascular disease. You can change this by making better food choices to reduce free radical damage and inflammation and improving insulin sensitivity. High nutrient, low glycemic index plant food can improve this, and so can supplements like S-acetylglutathione and plant-derived compounds like curcumin, boswellia, ginger, and hops.